Tonight, the CDC is now warning about 4 respiratory illnesses on the rise in 35 states: the flu, COVID, RSV, and norovirus. ERs across the country seeing a surge of patients. Many of those cases are flu-related.
I'm a doctor of internal medicine and pediatrics, and this is true, so let's talk about it. As of right now, over 40 states are reporting high or very high flu activity, and majority of these cases being influenza A. And even though a lot of people do not take the flu seriously, unfortunately, it can be very serious. Tragically, there have been 17 pediatric deaths related to the flu so far this year. Even outside of the impact on the pediatric population, we are seeing an upward trend of hospitalizations in the adult population for influenza as well. It's also important to note that we are seeing a lot of RSV in the pediatric population as well as the elderly population. I specified those two because those are the two populations that are most likely to be hospitalized from RSV. And lastly, COVID. Yes, we are seeing hospitalizations rise for COVID as well, primarily in the elderly population. So in summary, there's an upward trend of hospitalization rates for all 3 viruses currently. And again, the most likely to be impacted in a severe way would be the young, the elderly, and the immunocompromised. So knowing this, it's important for all of us to try to take necessary precautions to protect everyone around us. So what that means is that even if you just have the sniffles, it's appropriate to wear a mask when going out in public, staying away from vulnerable population groups, making sure to practice intense and frequent hand hygiene, not kissing anyone's babies. If you are sick, try to stay home as much as you can. And lastly, norovirus. Yes, it is still spreading. This is a virus that causes the stomach bug, can cause profuse vomiting and diarrhea, usually only lasts for a couple days, but it can be shed in your stool for even 2 weeks after you have symptoms. Hand hygiene is paramount. Hand hygiene is paramount. This means diligently washing your hands with hot water and soap. It's spread through fecal-oral transmission, so that means you get poop particles on your hand or on surfaces, and then you touch your mouth, and then you get inoculated with the virus. The most serious complications are profound dehydration. So if you, a loved one, or your child is not able to keep up with their fluid intake due to the profound vomiting or diarrhea, it would be important to seek medical attention. Make sure to replenish your losses with oral rehydration solutions such as Pedialyte, or there's a multitude of others. Long video, lots of viruses spreading out there. Stay safe out there, and also help keep others safe around you.